Welcome to Atrium Health, Navicent Knows Health. I'm Cindy Busby, and I'm here today with Dr. Cynthia Roland. She's a board-certified OBGYN, and she's board-eligible in maternal fetal medicine. And today we're going to talk about her practice in Central Georgia. Dr. Roland, thanks so much for being with me.
It's nice to see you.
Would you tell our audience a little bit about what the specialty of maternal fetal medicine is, so they understand your specialty?
Sure. So maternal fetal medicine specialists are trained in OBGYN, and we do additional training to take care of patients who have pregnancies that are complicated either because of maternal medical conditions, so if mom has an underlying medical illness that makes her pregnancy high risk, or if we diagnose a problem with the baby that makes the pregnancy risky for the baby.
And when it comes to your additional training, how many years do you spend in additional training after your OBGYN residency?
We do 3 additional years of training.
And when it comes to patients who come to you, do they normally identify that they have an issue, a pre-existing chronic condition, or are they referred by their primary care doctors?
So the majority of the patients we see are referred by their primary OBGYN doctor. They identify that the patient has a complication that they're not comfortable taking care of, or the patient needs to deliver the baby here for reasons that the baby may need to be in the NICU, and those patients are sent to us for pregnancy care.
Well, medicine around fetal medicine and maternal medicine has come such a long way. When a patient presents to you, is the mother your patient or is the baby your patient?
Well, in maternal fetal medicine, we always say that we have at least 2 patients. So the mother is first our patient, always, the mother always comes first. But then we also have an additional patient or 2 or sometimes 3, being the baby.
Is one of the common conditions that maternal fetal medicine works with multiple pregnancies, multiple babies, multiples?
Absolutely. So at baseline, pregnancies that are multiples are at increased risk for most complications of pregnancy, so many of those patients are referred to us for ultrasound or for care of the entire pregnancy.
How far along in a woman's pregnancy, and again, I'm sure it varies, but as an average, how far along in a pregnancy is something like this normally determined by their OBGYN that they might need to see you?
It depends on the scenario. Sometimes very early in the pregnancy, the OBGYN will know that the patient has a serious medical condition and needs to see a high-risk OB specialist. Other times, if it's a problem with the baby, most of the time those ultrasounds are done about 20 weeks, where they find that the baby may have a serious birth defect or some other complication, and those patients are sent a little bit later.
What are some of the diagnostics or technologies that you use when patients come to you, just in a general sense?
So the majority of the time we're using ultrasound with everything that we do. All of our patients have an ultrasound to look at the baby and to see, if there's anything that may not have been identified by the primary OBGYN. And then most of the procedures that we do are also done with ultrasound. There is a procedure called a fetal MRI, which can also be done if there's something that we're not able to see well with ultrasound. Sometimes we'll order a fetal MRI as well.
So when it comes to doing the diagnostics and interventions, are there also some cases when surgeries are required, maybe on babies before they're born?
There are scenarios, rarely, where a procedure needs to be done before the baby's born, and we do many of those here at the medical center. Sometimes a baby can have an obstruction that is causing fluid to build up in different areas, and we can perform a procedure called a shunt that allows that fluid to be relieved.
Do you find that your patients are patients who are going to deliver early, or do the majority of your patients, you believe you try to get them all the way to 40 weeks? I'm sure that's probably the goal, but do you find that they're generally early babies?
The goal is always to get the patient as far as we can safely to decrease the risk of prematurity, but many of our patients do have to deliver early because we have to weigh the risk versus benefit of keeping the baby inside and allowing the baby to mature versus getting the baby delivered so that it can have whatever interventions it needs post-delivery.
What role does the family play in the mother's care when she is referred to the high-risk specialist?
The family is probably the most important part of this because when a woman is pregnant, it's already a big stressful situation for any woman to go through, and then having the support of their family is always very important.
Are family members able to participate in the care? Are they groups that you want to educate at the same time?
Absolutely. And to be honest, COVID has made that very difficult because we're doing a lot of that via FaceTime and other means using technology, but we do really like to try to educate the father of the baby when they're involved and any other family members who are going to support that patient.
When it comes to getting to your office, do you also get referrals from all around the state as well as from Macon and Warner Robins?
We do. The majority of our patients are from Macon and Warner Robins and the Central Georgia area, but we do get referrals from other parts of the state because they don't have the resources that we have here.
And when it comes to maternal fetal medicine, why was that a career that you picked after being an OBGYN?
So when I was an OBGYN resident, I found that my passion was definitely taking care of pregnant patients, and especially the ones that were going through difficult times that really needed support and needed a physician who was going to show them as much compassion and care as they possibly could. And so I found that was very rewarding to me to be able to take care of these patients who are very scared and who have very serious complications.
Well, thank you so much for telling us so much about your practice. And thank you for watching us at Atrium Health Navicent Knows Health. If you'd like to know more about Dr. Roland and her practice, please visit us at atriumhealthnavicent.org.